Hello friends, I'm Dr. Abhishek Saini and today I will be sharing information on hepatitis B and T virus. Alright, and if you are new to my channel, do like, share and subscribe to my channel, and let's begin this. Hepatitis B infection is caused by hepatitis B virus, which is a DNA virus, and also classified as hepatomegaly, and hepatitis D is caused by hepatitis D virus, which is a defective RNA virus which usually co-infects with or needs helper function from hepatitis B virus for its replication. Now talk about its pathogenesis. Basically, our body or our cell membrane have nucleocapsid proteins present on its surface, which are the most target viral antigens via host antigen. With the host antigen, it invites cytotoxic T cells for killing infected hepatocytes or liver cells. Whereas hepatitis D pathogenesis is not yet known properly. So let's carry forward to its transmission. How hepatitis B and D infection transmitted? It is transmitted via percutaneous route, means by sharing needles, or perinatal from mother to fetal transmission, and sexual transmission. Now, what are its symptoms? Its symptoms goes from two phases. First one is prodromal phase, which is characterized by fever, sore throat, pharyngitis, cough, nausea, vomiting. These all are belong to prodromal phase. And second one is icteric phase, which is characterized by jaundice. Because there was anorexia in prodromal phase, so patient may present with history of weight loss and complain of dark urine or clay colored stools. And on examination, icterus may be present, raised temperature will be there, and on per abdomen findings, splenomegaly or hepatomegaly may be there. Now let's talk about its severity. Hepatitis D and hepatitis B, both are occasionally severe, and there are 0.1 to 1% chances of hepatitis B infection to go into fulminant, means it may lead to fulminant hepatitis, means liver failure or liver cells necrosis. Whereas there is 5 to 20% chances of hepatitis D infection which leads to hepatitis, fulminant hepatitis. And lastly, there is increased risk of cancer in neonatal infection of hepatitis B virus, whereas its risk is variable in hepatitis D virus. Now let's talk about its diagnosis. For diagnosis, we have various tests like complete blood count, which may show neutropenia and lymphopenia in the initial phase, and which later followed by lymphocytosis. Secondly, we can check serum bilirubin levels, which will be raised and much more raised in patients suffering from hemolytic anemia or aplastic anemia. We can go for blood sugar levels because there will be decreased liver gluconeogenesis, due to which there will be decrease in blood sugar levels. And we have liver enzymes, which will show increase in SGOT and SGPT levels. And we can go for serological markers. And serological markers for hepatitis B is HBsAg and HBeAg, which may go absent after 2-3 months. So we have to diagnose it in early phase. Whereas for hepatitis D virus, we have anti-hepatitis D virus antigen. Now what if serological markers for hepatitis B and D are positive together? we should go for anti-HBC levels, which is very important for knowing whether this infection is present or a past infection. Lastly, we can go for polymerase chain reaction for detecting DNA of hepatitis B virus and RNA of hepatitis D virus. And lastly, ultrasound for detecting hepatomegaly, splenomegaly, alright? And then we have its treatment. We have various antivirals available for its treatment. And what about its prognosis? Hepatitis B prognosis get worsened with increasing age. Whereas if there is acute infection of hepatitis D virus, in that case prognosis is good. And if there is a chronic infection of hepatitis D virus, then it means its prognosis is poor. Now, how can we prevent it? Use separate needles whenever you need it. And we have immunoglobulin inactivated vaccine, hepatitis B vaccine. For it, you can take it at 0 dose, first month dose and 6-month dose, and it is also included in our national immunization schedule for kids, for infants, and for adults. You can take it if you are a healthcare worker or if you are living with a person who is hepatitis B positive, then you should immunize yourself. Lastly, thank you so much, and I hope you have learned something from it. And if you learned, then do subscribe my channel and like and share this video, please. And thank you so much. And for any suggestion or for any topic you want by me to make a video, then you can comment below. Thank you so much. Do click the subscribe button. Thank you so much.